I've known Brent for about 8 years or more, and we met in the context of sharing some clients and collaborating on my doing therapy and Brent doing testing. Over the years that I've known Brent, he's really become my go-to guy for psychological testing. I've had plenty of chances over the last several years to look over his reports and to consult with him by phone and in person, and consistently he's done an excellent job helping to develop treatment plans, providing thorough and accurate assessments of children with all types of disorders. And I would say he's really become instrumental, I think, in this community in terms of providing the services that he does. Often when I refer somebody to Brent Cooper, the scenario might be a family coming to me for therapy, or it might be in the midst of a custody evaluation or a consultation in a family case. And when children come in with learning disorders or apparent concerns involving ADHD or autistic spectrum issues, he's got a wide range of tools in terms of hands-on observation, computerized assessments, and he's probably using the most current tools and assessment techniques locally that I know of. So again, you know, Brent's really become my go-to guy when I'm working with younger children, and in some cases even adults when it's dealing with ADHD or learning disorder issues. He's my main go-to person when I know I need a really thorough, comprehensive, and helpful assessment. A parent will ask me questions about their child's behavior with concerns about poor grades in school, about behavioral problems, about hyperactivity, or possibly even withdrawal or depression. This is where Brent comes in for me. When there are specific questions regarding learning disorders, to find out if there's specific problems with reading, with math, with spelling, Brent can assess these issues and determine where specifically the problems are and what grade level a child may be at. Brent has some great tools to assess for hyperactivity, inattention, impulsiveness, and these are all some of the cardinal features of diagnosing and identifying attention deficit disorder and whether or not there's hyperactivity. Other issues may involve perhaps some issues with socializing, or some concerns about a child not really fitting in with their peers. And this is where Brent can be involved in assessing for Asperger's or autistic spectrum issues. And across the board, you know, I've come to really trust Brent and his assessments. They've been helpful in terms of explaining issues to parents and in terms of setting up treatment plans. And when I'm working with children and families in therapy, to help work with the families and the children to change their behaviors to be more successful. I mean, well, clearly as a clinician and as a psychologist, somebody who also has done, you know, hundreds and hundreds of assessments with children, to have Brent complete a more up-to-date, thorough assessment with pretty much the most current measures. Again, it's extraordinarily helpful just in terms of understanding a child's behavior, in terms of helping a family work with their children, and even on occasion working with schools and teachers in terms of modifying plans and helping teachers as well understand a child's behavior. We've collaborated on numerous cases, and I'm thinking about the parent who's calling him or contacting for the first time. Brent is an all-around good guy. He's easy to talk to, he's friendly, he has children, he understands about how to relate to kids. And this is something that is crucial in terms of making that connection and gaining a child's involvement in the assessment process. In my sense, especially on a professional level, Brent is somebody who communicates with me. He'll take the time, we'll discuss results, we'll talk about treatment planning, and so he makes himself available. And so my sense of Brent is that those things make him a very, very effective and a very, very strong educational clinician.